everyone, and welcome. My name is Leah Lewin, the perinatal specialist. I am an educator and consultant for various charities, universities, and organisations throughout the UK. And I'm here with you today because I would like to share some information around postnatal conditions, body awareness, and physical well-being. So I'd like to start off by saying that it is my intention to ensure that this is a safe space and that I am also an advocate for inclusivity, which means I wish to ensure that everybody is able to feel welcome and acknowledged. Now, I may refer throughout this session to body parts which you may not have. I don't want to negate your experiences, but I want to just address from the beginning that I will be including these body parts to ensure that everybody's experiences is recognised and heard. You may also notice that my language may be interchangeable throughout this session. So hello and welcome, and thank you so much for being here. Whether you have joined as a new parent, a parent that's further along in their journey, a birth partner, or even a professional that is supporting postnatal families, I want to honour the fact that you have taken this time for yourself. So this session, as I said, covers postnatal conditions, body awareness, and physical well-being. So over the next hour or so that we have here together, I'm going to guide you through what happens to the body after birth. We'll explore how you can tune into the body's needs, what changes are normal and not so normal, what might need a little bit of extra care, and practical ways to support your physical recovery. I want to set the tone from the beginning. This is not about bouncing back or trying to reclaim your pre-pregnancy body. This is about reconnecting with your body, understanding it, the changes that it's just been through, and caring for it as it heals and adapts. You might be listening as someone in the early days of postpartum, or perhaps your birth was months or even years ago, or you're simply here for somebody else. Wherever you are, this is for you. It's never too late to check in or nurture your well-being or that of a loved one. And a gentle reminder, as we go through, you might hear things that resonate deeply. You may even notice emotions coming up, and that's okay. Pause if you need to, and take a breath. Your experience matters here. So let's start with the basics. Your body has done something extraordinary. Whether you gave birth vaginally or via cesarean section, pregnancy and birthplace immense demands on every system of the body. I'm talking about musculoskeletal, cardiovascular, hormonal, emotional. So in the weeks following a birth, the body enters a period of recovery. It's often described as lasting 6 weeks, but in reality, healing takes much, much longer. So let's break down what's happening, starting with your uterus. Your uterus is shrinking back to pre-pregnancy size, and this can cause cramping, after pains, especially if you've chosen to breastfeed. It can be something that you notice significantly during those sessions. Lochia, which is the post-birth bleeding. Now, again, on average, it will last for around 6 weeks, maybe more, maybe less for some people. And again, this can be to do with the mode of birth. So it starts a heavy, bright red, and then it gradually starts to taper and changes color. And you may notice it changing to a really deep, rich, dark red or even brown color. Some people towards the end can notice a slight pink in the discharge. If you are concerned, please do consult your healthcare provider. Hormones, as we know, these shift from conception throughout pregnancy, but they shift dramatically again after delivery. And the levels of estrogen and progesterone start to really plummet. And this can affect everything from your mood to skin and even joint stability. I don't know if you've heard of PGP or SPD. It used to be known as symphysis pubis dysfunction, and it's more commonly recognized as pelvic girdle pain now. And this can continue postnatally too. You may notice that your breasts may feel tender and full or even engorged as milk production starts to adjust and you're finding your flow. I want to take a moment to acknowledge all of the mothers and parents that may have lost their babies, that will still have all of these feelings and all of these symptoms, and they are very real and very valid, and a constant reminder and a nod to your parenthood. I want to acknowledge you. And we also have the consideration of the pelvis and the pelvic floor and your abdominal muscles. They're stretching, they've been stretched, should I say, and they may feel weaker now. They may feel sore and tired. You've been through quite a process. You might notice changes in bladder control and core strength, as well as things like posture. These changes are not flaws. They are signs of an incredibly adaptive and resilient body that's doing its work. But sometimes these adaptations just need a little bit of. So, common conditions and signs to look out for. I want to talk about specific postnatal conditions and have a look at what's normal and what deserves a bit more attention. So when we're thinking of perineal healing, if you've had a vaginal birth, you may have experienced tears, an episiotomy, grazing, or even bruising. Healing usually takes a few weeks, but pain, swelling, or signs of infection like increased redness, a foul smell, a fever, it might be hot to touch. All of these things mean that you should seek medical advice, and that's very important. If you've had a cesarean section, so for those of you that have, there's recovery of both skin and uterine levels. It's common to have numbness or itching around the scar. Gentle movement is encouraged. Scar massage once it's healed, and listening to your limits. It may have been what felt like a few minutes, but this is major, major surgery. And it's often disregarded. We can't negate what your body has been through. So ensuring that you're taking care of not just your scar, but as your abdomen starts to heal and your muscles start to contract and your body is working to bring itself back together, it's very important that, again, you look out for signs of infection, signs of additional injury. Now, pelvic floor dysfunction can be something that happens regardless of the mode of birth. So 1 in 3 women experience postnatal incontinence. So that's leaking, urgency, or a real sense of heaviness that could indicate pelvic floor weakness or even prolapse. A pelvic health physiotherapist, or a women's health physiotherapist, as they're often known, can make a life-changing difference. Now, I alluded to this a little bit with the cesarean section, but again, this is not dependent on the mode of birth. Your abdomen muscles naturally separate during pregnancy, and for some, this gap then persists. Signs include doming, so you may find in your tummy you have a bit of doming, or a feeling of weakness in your core, core strengthening exercises that are guided by a specialist can really help, because abdominal separation, also known as diastasis recti, can mean that as you do recover and you feel like you're getting back on your feet and things like that, you may still have that separation. And again, as I've said, even if you're not immediately postpartum and it's been a few years and you're thinking, oh, is it too late for me? Absolutely not. Speak to the specialist. They can offer you great support and information. Referring back to your breasts now, look out for signs of mastitis. So redness, heat, pain, any flu-like symptoms. With mastitis, early management is really, really vital. And again, look here, postnatal bleeding. So bleeding that is suddenly heavy again with large clots or has a bad smell should really be checked. This isn't about making you worry. It's about giving you the knowledge to advocate for yourself and ensure that we're taking care of our postnatal bodies as well as our new baby. Oftentimes, a lot of the focus isn't on the individual that has given birth. It shifts to your wonderful newborn, but it's just as important to take care of you. So let's think about your body awareness and listening without judgment. So now let's shift from what to how. It's easy to feel disconnected from your body after birth. Perhaps it feels different, unfamiliar, and even frustrating at times. Now, I am a mother myself, and as body confident as I wish to be, I still felt a bit uncomfortable in my own skin at times, and that's okay. Body awareness is about gently tuning in, noticing without judgment. So let's try this together. I want you to place one hand on your belly and one hand on your chest and take a slow, deep breath. Feel the rise and fall. Notice any sensations. This is the first step in tuning in. Notice, feel, listen. Start rebuilding that connection with you. And some simple practices that you can use: body scanning. So from head to toe, and just taking your time with each part of your body. And again, I want to recognize that you may not have every part of the body that I may refer to, but noticing as much as you can, noticing any tension, notice any comfort. Postural check-ins. How are you sitting? How are you feeding your baby, carrying your baby? When you're alone and you're relaxing, what can you feel within you? And small adjustments can start to ease strain on your body parts. Breathing exercises are another great practice. I think as a society, we often take for granted how important and useful breathing is. We do take it for granted. I know sometimes when I've got a bit of a stuffed nose, I think back to the times when I didn't, and I wish I didn't have a blocked nose. And you feel like you've taken breathing for granted on so many occasions. I want you to really tune in and think about incorporating breathing exercises. So deep belly breaths, because they can support your core and your pelvic floor. The key is consistency rather than intensity. So gentle, regular attention creates a foundation for strength and confidence, helps you to build those really healthy habits. Okay, so physical well-being, as I said, supporting your recovery. Nutrition is a big one. Healing requires fuel. If your car's been for an MOT, you take it home. You don't stop putting gas in your tank just because you passed. So we need to prioritize fueling our bodies to aid them in their recovery. So prioritize protein for tissue repair, iron-rich foods to replenish stores, vitamin C for collagen synthesis, omega-3s for inflammation and mood support. And don't underestimate the power of hydration, especially if you're breastfeeding. Movement's another thing. So when you're feeling ready, start with gentle walking. Avoid high impact activities until cleared by a healthcare professional. Postnatal yoga or Pilates are wonderful, but always listen to your body. If you feel like you need to rest, that's more important. And look out for signs that you might be overdoing it, including things like increased bleeding, pain that wasn't there before or had reduced and has now started to increase. Feeling exhausted. Again, you have a baby that you're caring for. You don't want to push yourself to the point of exhaustion. These are cues to rest, not to push harder. And sexual health. So it's common for sex to feel different in the postpartum period. Physically, emotionally, hormone changes can cause vaginal dryness, and scar tissue can make it very tender. You may be feeling nervous. There may be an element of fear. You may have experienced a form of physical trauma. It's really important that you take your time, communicate with yourself and also with your partner, and seek help if pain persists, or if you're experiencing any symptoms alongside or even without pain. You have the right to enjoy your sexual health and relationships. Oftentimes, it may feel that society minimizes these encounters for women and people who have just recently given birth. That's not the case. You deserve to have pleasurable experiences. So even if it's not pain, but it doesn't feel right, please seek support. It's very important. And when do you seek support? You are the expert on your body. Now, society may have perpetuated this hierarchy of power and control, but you are the expert when it comes to your body. And if something just doesn't feel right, trust that instinct. Go with your gut. Seek help for pain that's worsening or just not improving. Bleeding that's unexpectedly heavy, or it just continues to persist after months and months. Incontinence or pelvic heaviness. It's not something to be embarrassed about. And oftentimes, the earlier you seek support, the better the outcomes. Don't feel embarrassed. Breast changes that come with flu-like symptoms. All of these things are really important for you to seek help. You deserve care that is thorough, respectful, and responsive. And that's exactly why I created Mayo. Mummy, are you okay? Too often, I hear from parents who say their 6-week check felt rushed, leaving them with unanswered questions and lingering worries, or that they just focused on the baby and it was a simple, how are you feeling? With Mayo, you get a full hour with me and we'll talk about your mood, physical concerns, nutrition, sleep, sex, non-sexual intimacy, and relationships, and everything in between. I'll then create a detailed report which you can share with your healthcare provider. The standard fee is £75, but if you quote Nurturing Lifestyles, you'll pay only £50 because you deserve more than 15 minutes. I want you to remember this. Your body is not broken. It's healing and adapting and holding you through one of the life's biggest transitions. Check in with yourself daily. Offer your body space, time, and compassion. Ask for help when you need to. And most importantly, you're doing better than you think. Now, I've also included in the workbook some detailed information about various postnatal conditions. And I would like to just take a moment to reflect on some key areas. So as I mentioned and alluded to earlier on, postpartum infection can occur in the uterus, the perineum, wound site, or even in the urinary tract. If you are having signs of fever, flu-like aches, a foul vaginal smell from the discharge, warm, red, or painful wounds, please, you need to seek immediate medical attention if these symptoms appear. Now, again, this is not to worry you. However, this is something that, if caught early, can be treated efficiently. However, if there is a delay in care, that's where we find further complications. Late onset postpartum hemorrhage. Again, it's not a common one, but things like heavier than usual bleeding after day 10, a sudden gush of blood, or large clots. This needs urgent care. You need to contact maternity triage or attend your local A&E as soon as possible. And I want to highlight these things because all of these elements, all of these common postnatal illnesses or uncommon postnatal illnesses are something which can be stopped in its tracks if you get early attention. And it's important to recognize that you're not wasting anybody's time. Speak to any midwife and they will tell you they would rather you come in just to be sure than to leave it and be uncertain and question. When we think of life-threatening conditions, so whilst most people recover well after birth, there are some conditions that can go on to be life-threatening. One of those is postpartum preeclampsia. And you'll see I've highlighted in the handbook that it's very important people seek support and help urgently. The signs to look out for are severe headaches that aren't going away when you take paracetamol or ibuprofen. If you're having visual disturbances, flashing lights, blurred vision, that twinkly sensation that we can't quite name sometimes. If you notice any swelling in your hands and your feet, your ankles, and even your face. If you have pain in your rib cage, and then if you are seeing your GP or healthcare professional, or you go in to check and they notice things like high blood pressure and protein in your urine, this is very important. You need to ensure that you are getting urgent help. If you feel like you have been dismissed or you haven't been heard or your concerns are not being acknowledged, ask for a second opinion. And I want to also highlight here that Black women and pregnant people and birthing people have a higher rate of being mis or underdiagnosed due to racial bias and the lack of correct symptom interpretation. It's very important, if you have concerns, you address them urgently. Now, hyperemesis gravidarum is another condition that is not commonly known. And when it is, it's often related to the antenatal period. But postnatal hyperemesis gravidarum is also very important to address, because things like dehydration, nutritional deficiencies, or even electrolyte imbalance. Again, if you continue to experience severe vomiting after birth and it's left untreated, it can lead to all of those things. Things to look out for if you're unable to keep your food down or drink. So that includes water, even if you're taking small sips. If you're unable to keep them down, you're experiencing a lot of headaches, feeling very dizzy, lightheaded. You've noticed that you continue to have dry, cracked lips and a dry mouth, again, another sign of dehydration. And there is a notable weight loss or extreme fatigue. Please ensure that you see your healthcare provider. And there are a couple more that I'd like to bring to your attention. Again, this is all listed in the handbook for your reference. But sepsis, now this is a medical emergency in any case, and it can result from having an infected scar or stitching, retaining elements of your placenta. If you have endometriosis, if you're known to have endometriosis and you've been diagnosed, again, it's something I'd like you to keep in the back of your mind. And UTIs, mastitis, any form of infection. So if you notice, similar to signs of stroke, I guess, slurred speech, confusion, if you notice a mottled rash or discoloration in your skin, in black and brown skin, it may be like a grey, bluey colour, or just an unusually dark look. Very important. Feeling really breathless, slurring your speech, feeling very confused. If others notice or mention that you seem very confused, and again, feverish symptoms, feeling very cold and clammy or shivering, being unable to pass urine, all of these things are a sign. And of course, if you are feeling an intense fear around your own well-being, feeling that you may be going to die, and that sounds very dramatic, but sometimes you may get that feeling, please call 999, get to A&E immediately. Blood clots is another one, especially if you have a history of pulmonary embolism or deep vein thrombosis. So the risk of blood clots increases after childbirth, especially following major surgery like a cesarean section and having reduced mobility. If you're not doing the exercises, and even if you are and you're having the compression stops and all of these things, it's really important that you look out for signs of deep vein thrombosis, also known as DVT. And that can be shortness of breath, suddenly feeling breathless, pain in the chest, coughing up blood, rapid heart rate. So they're all signs of a potential pulmonary embolism. Pain in the arm is another one. Swelling or redness or warmth in one leg, or it feeling painful or very heavy. All of these things, again, please seek medical attention. It may just be that you are experiencing some discomfort, but it might not be, and it's always more important to ensure that it's not something bigger. And peripartum cardiomyopathy. So that's postpartum heart failure. Now, this is very, very rare, but it's a serious condition. And it's when there's been a lot of pressure on the heart and it feels like it's become weakened or enlarged or under a lot of pressure. And you'll often notice that the presentation starts within the first 5 months. So again, shortness of breath, chest pain, feeling exhausted, a real sense of extreme fatigue, swollen legs and feet, rapid or irregular heartbeats. These are all things to look out for. Now, these aren't necessarily conversations that you will find yourself having or being privy to in your antenatal sessions as standard. And it sounds very, very scary. My intention is not to scare you at all. My intention is to ensure that you're informed because you don't know what you don't know. And we're at a crossroads at the moment. There is a lot of trauma porn and scaremongering online where people are sharing, some rightly and some wrongly, information or misinformation around the perinatal period and well-being and health. There are a lot of experts and gurus online, and it's becoming a very scary place with all of the reports, surveys, studies that are being done showing the disparities in mortality and morbidity rates for pregnant people and neonates. The reason I'm sharing this information with you is to ensure that you know what to look for to avoid becoming those statistics. If you are ever unsure, if information is being shared with you, it's okay to say, can we stop? Can I take a minute? Just need 5 minutes to digest what you've said. I just need a couple of minutes to ask some questions. If you have questions, note them down. If you just feel this doesn't feel right, I don't feel right, it's okay to ask for a second opinion and ask for support. You can do things like take photos, keep a journal tracking your symptoms, or even have it as a diary so you can see how far you've come in your journey. If you wish to query any of the care that you've received, ask for a printed, ask for your records printed. Now, it can take a while for some trusts, but you have every right to receive your records. It's often easier if you ask in the hospital before being discharged. There tends to be more urgency. Take photos, keep referral letters. If you're unsure, ask to see a specialist based on your concerns. There are also a lot of great organisations and charities, NGOs, that offer great advice and support, lots of information and resources, but ensure that you are getting them from a credible source. In the handout, I've included a few national support services that can be really helpful. And of course, if you have any concerns, you're absolutely more than welcome to reach out to me, ask questions, share any concerns you may have. If it's not something that I can support you with directly, I will always ensure that I signpost you or provide you with the means and information to find more appropriate support. Please do not feel like what you're experiencing, oh, it's common, that makes it normal. Something can be common. It doesn't make it normal and it doesn't make it okay. You know yourself better than anybody else, and it's important that if you are concerned, your concerns are addressed. So before we have an opportunity to kind of slow down and reflect, I just want to reiterate that your body has experienced profound changes. Childbirth is an immense journey. And sometimes these journeys may look different when we think about medical intervention. If there are any illnesses, injuries, or any other factors of marginalization that can impact your experiences. This is a time that's often painted as joy and pride, happiness, elation, but it can also come with the heavier emotions. The two can be true at once. Having a low mood doesn't negate the fact that you may be truly grateful for your experience. Birth debriefs are a great way to break down and make sense of your experience. If your birth wasn't exactly as planned, these can help you to understand what happened. If you felt there was a lack of immediate control and support, it's something you can refer back to in order to gain some clarity. It's also very important if you want to go down the route of making complaint or litigation. Now, if this is something you would like to discuss further or you are looking for more information, Birthrights is a wonderful charity that has a host of information that is readily available to families. If you have experienced any form of birth trauma or perinatal trauma, Make Birth Better is another fabulous organisation with lots of information and resources available to you for your support. And you can find this information within the National Support Services element in the handbook. Now, I'd like you to take a deep breath. I'm going to take you through a visualization exercise. Now get yourself into a comfortable position and close your eyes, or just soften your gaze if it feels more comfortable. And we'll start with a short body scan. Now this won't be a full, deep yoga nidra body scan. It's not spiritual guidance. It's just a relaxation exercise. Something you can add to your self-care toolkit in order to ensure that you are finding ways to manage your own well-being. Now, I'm not going to guide your breathing. I'd just like you to take some long, deep breaths. Inhale through your nose. Exhale through your mouth. Inhale through your nose. Exhale through your mouth. Inhale through your nose. Exhale through your mouth. I want you to feel from the bottom of your feet, what sensations are you feeling in your toes? Are you feeling pressure from footwear or the floor beneath you? Are you feeling warmth, tension, relaxation? You may want to give them a little wiggle. Moving through to your ankles, what do you notice? I'm rolling mine gently to release mild discomfort. And as we move up our legs to our knees, noticing what I can feel in the joints. Is there any tension in your knees? Moving up to your thighs. Let them melt into the seat below you. You may want to just wiggle your hips a little. Stretch out your spine. all the way up to your neck. Rolling your shoulders, turning your palms face up, stretching your fingers, and relax. You may want to stretch your neck a little bit, backwards and forwards, side to side, up and down. What sensation do you feel in your ears? Other than the sound of my voice, is there anything else that you can hear? Can you hear yourself internally? Is there an internal monologue speaking to you? Are you truly present in the moment? What can you smell? What can you taste? And as we continue with our body scan into our minds, I want you to visualize a birthing place where you feel comfortable, supported. You've experienced a birth unique to you and your needs and your wishes for your family. You may be in a birthing centre. You may be on a labour ward. You may be at home in bed or on the sofa. You may be in water. I want you to consider this time and continue to move through this positive emotion. I want you to go to a place where you feel most comfortable. And I want you to see yourself comfortable, supported, acknowledged, and cared for. Now, with the safety that you require, I want you to look around the room as you reflect on your experiences. I want you to look at your postnatal body. Maybe place a hand on your tummy and feel gratitude. Thank you. Thank you for carrying this baby. I appreciate the work that you have done to support me, to ensure that I am well and I am safe. I want you to notice any changes on your skin. And I want you to experience the gratitude. I want you to recognize this pause. And I want you to encourage you to ensure that you start to feel comfortable just taking a moment to pause, to check in with yourself, not just emotionally, but physically. remember to pause. Now, when you're ready and you feel comfortable to do so, I'd like you to bring yourself back to the present, opening your eyes. Look around at the others in the room. Maybe smile to one another. Now, when we talk about the postnatal period, there's often a focus now on mental health. The two can be true at the same time. Checking in with yourself to ensure that your mental health is acknowledged is very important, as is your physical health. You deserve the time and space to acknowledge both parts. Don't forget to pause. Slow down. Now, if you're anything like me, slowing down can be something that has to be a conscious decision. It can feel uncomfortable, can feel a bit too slow. But I hope even in that short exercise, you were able to feel somewhat comfortable in slowing down, in pausing and taking time to acknowledge you and your physical needs. Now, if you have any concerns or questions, you are more than welcome to reach out to me and ask questions or request additional support. You can follow me at theperinatalspecialist.com or email Leah at theperinatalspecialist.com. Thank you all for your time today.